Okay, so if inflammation is a contributing factor to virtually all chronic disease, then I guess the question we want to answer today is, what's the underlying cause of this inflammation?
Introducing the Paramena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Paramena Bliss Podcast.
Hey, this is Doc Yates. Welcome to the Paramena Bliss Podcast, brought to you by PerimentalBliss.com and ablehealth.us. And today I want to discuss inflammation, and we're going to go through 4 absolutely key things that you need to consider when it comes to dealing with inflammation, because if you can deal with the inflammation, then you can deal with most chronic conditions. Or I would even go even more importantly, prevent most chronic conditions. So let's dive into it. So most chronic health conditions are linked with some degree of inflammation, and I'm not talking like you sprained your ankle and it's super huge, hot, and swollen. I'm talking about low levels of chronic inflammation. Heart disease, cancer, a lot of autoimmune diseases, anything even not just affecting the heart, but your circulation, your brain, even aspects of dementia. And mood and depression have been all linked with inflammation. So, let's dive into these top 4 things that you need to address when it comes to preventing inflammation and preventing these conditions. Number 1, this one is structural. This one's not as important when it comes to like full body systemic inflammation, but it still plays a role, especially when it comes to like the physical part of it, like your physical body. So structural. The big thing here is that, is there anything you're doing that you're like an overuse? Especially, this more applies to if you have a job and you just do the same thing all day, like you work in a factory and it's just like turn this wrench, turn this wrench, turn this wrench. That's going to lead to a lot more localized imbalances, inflammation, pain, overuse, injuries. The next thing that plays a really big role when it comes to structural inflammation is your weight. If you're overweight, imagine that overuse injury applying to all of your weight-bearing joints with every movement that you're doing. Not to mention, excess weight causes your body to produce more inflammation. So you're literally wearing out your body faster and increasing inflammation all at the same time, and I would strongly encourage you to get the weight off. But the nice thing is that as we go through this, you're going to see that some solutions contribute to multiple factors, and we're going to dive into that too, so don't worry. And the last thing from a structural standpoint is imbalances. If you are training, say you're a runner. Running is great exercise, it's great for weight loss, it's good cardio, but it can lead to imbalances. So it can lead to a lot of tight hips, tight IT bands, tightness through the calves. So you want to make sure that you're trying to do exercise from a balanced approach. If you're having a harder work day, you should have recovery days that involve stretching, flexibility. Because remember, I've talked about this before, but if you're a new listener, when it comes to exercise, the things you want to make sure that you're addressing, there's strength, there's cardio, there's flexibility, and there's balance. And whether you do that all in one workout or whether you're rotating through each workout to get that, you want to make sure that those factors are addressed because they play a big role with long-term health, longevity, and function. Okay, let's dive into the second aspect of inflammation. I think this one's probably the most important because the other ones can contribute to it, but it's your immune system. Your immune system is what's responsible for creating this inflammation. But it doesn't create it for no reason at all. It creates it in response to something. Inflammation is the body trying to respond to something. The majority of the times, it's infection. So you want to think of, imagine when you get, it's cold and flu season and you get a sore throat and your throat is really hot, swollen, red. That is inflammation. Technically speaking, it's not the virus that caused that. It's your immune system in response to the virus that's causing it. Okay, unlike even when you sprain your ankle, it's still how the immune system is responding to that tissue damage that's causing the majority of those symptoms. It's the immune system. Is the answer to suppress the immune system? Absolutely not. When it comes to infection, the answer is how can we help the body by dealing with this infection? So how can we, I think improve is a good term. I think balance is a good term when it comes to the immune system. You don't want to push the immune system, because you don't want it to push it too far in the other direction. That's where people get into autoimmune or allergies. But you want to do a lot of work with balancing the immune system and to help the body fight infections. So using natural antimicrobials on a regular basis is a very good idea. People are like, whoa, are you talking about antibiotics? Absolutely not. You do not want to use something that can completely wipe out your natural flora and your healthy bacteria. But using things on a regular basis that have some sort of antimicrobial effect is really good at preventing long-term infection, especially these low-grade infections. So you're like, well, I've never had a sore throat that's lasted more than a couple weeks at most. I'm not talking about when it's in the acute phase. We're talking about chronic. And a lot of times there's issues with low-grade chronic infections that never properly got cleared, that the body is responding to and creating some low-grade chronic inflammation, which is leading to chronic health conditions. So, some basic examples. We put all these into our Oral Effects mouthwash, so that way every time someone's like getting ready before bed, they're taking some low-dose natural antimicrobials that won't wipe out your system. And these would include things like sage, thyme, Google gum resins. We'll put in cinnamon extracts, things that can really do a great job. And there's so many more. There's so many other herbs that have a great effect for this. But look for something that you can use on a regular basis and that's just built into your lifestyle, which is why we built ours into a mouthwash. The difference is with the mouthwash, instead of spitting it out when you're done, you swallow it. So it's rinsing out your mouth, cleaning out the bacteria out of your mouth, and then you're swallowing it, and it's going to help with the rest of your body too. The next thing when it comes to immune system, the immune system can react to, again, chronic low-grade infection and basically the viruses, bacteria that aren't properly cleared, but it can also react to food. And when it reacts to food, it's almost, they used to use the term molecular mimicry. So if there's something in your food that your body is recognizing basically as a pathogen, as something that's not supposed to be there, it attacks it. And then it attacks any of the tissues that it can be attaching to. This is where food sensitivities come in. Now keep in mind, the majority of food sensitivities that I see in practice, most of them are with foods that have been more modified, more hybrid foods. And because there's stuff in there that the body doesn't recognize as being natural, and it will attack it, and then it can lead to the attacks of those tissues that it's binding, the proteins are binding to. So, what does that mean? Cut out processed food would be the first thing. Really pulling back on the processed, overly refined food, and more, especially without going into more detail. There's a lot of other food sensitivities that you can see, like nightshades would be an example. But I would say as a starting point, white flours, white sugar. I would say sugar would be near the top of the list. Wheat would be up there. Not even necessarily gluten, specifically wheat. And I've seen a lot of clients where, not even just wheat, but North American wheat, because I've seen a lot of clients here get inflammation, strong inflammatory reactions to wheat. They're not celiac, but they're still getting these reactions. They go to Europe, they eat food there, and they feel fine. So, cut out the processed food. So that's only the second point. That's just the immune system. That is the immune system reacting to either infection or inappropriately reacting to foods because there's something wrong with those foods for you. The third thing is toxins, and this kind of ties into some of those foods too, but whether it's toxins that are in foods, and a lot of the times the toxins in food aren't even the food itself. So if you're eating a lot of processed food, say like sandwich meats with all the preservatives and chemicals in it, I see a lot of people get inflammatory reactions to that. For a long time, for instance, wine has always been touted as like, ooh, this is the healthy alcohol, but I see more inflammatory reactions to that than almost any other alcohol, and I think it's because of all the sulfites and preservatives and stuff that can get put into it. The other thing is like actual chemical toxins. If you have worked in a job where you're exposed to chemicals on a regular basis, you should always be doing something to detoxify on a regular basis. The risk factors for people with those types of exposures, for instance, firefighters, their risk factors for heart disease and cancer because of all that crap that they're breathing in is way higher than average people. Mechanics, it's also higher. It's because they're exposed to these chemicals on a daily basis. So if that's the case, doing things to protect yourself from these chemicals and doing things to help your body detoxify these chemicals as much as you can on a regular basis. So far we've gone through structural, we've gone through immune reactions to create inflammation, we've gone through toxins that can lead to inflammation, and the last thing, and then you can see how this all ties together, stress and cortisol. The more stress and the more cortisol, the more severe once you get to the point that your cortisol is kind of burning out, the more severe your immune and inflammatory reactions are going to be. So things that contribute to that. One, what are your coping strategies when it comes to stress? How do you deal with stress? Sometimes this could be a 2-for-1. If your best form for dealing with stress is exercise, then that could work out great, because then we can work on your weight, we can work on imbalances, we can work on stress all at the same time. The other thing is you want to make sure when it comes to stress, in terms of coping, is your sleep. Those things are going to happen on a regular basis that will be stressful. It could be something affecting your family or a loved one or your work. Your ability to do your best to not let those stressors get to you and how you perceive those stressors is important, but having coping strategies in place so you can handle more. So having a good sleep, if your sleep sucks, your ability to handle stress will be greatly reduced. So it's really important that you are getting good sleep and you're having stress coping strategies in place to help deal with your daily stressors. Now here's the interesting thing. There are a ton of natural remedies and plants that have a great effect on inflammation. Interestingly enough, the vast majority of those hit probably 2 to 3 of these categories at a time. A lot of the best anti-inflammatory plants are also good for immune system. They help with detoxification. Some of them can help with stress and cortisol and adrenal support. Let me give a couple examples. Licorice is a good anti-inflammatory. It's good for stress and inflammation. Schisandra is a very good anti-inflammatory. It's very good for detoxification and immune function. Turmeric is a good anti-inflammatory. It's good for immune function, and detoxification. Ginger affects multiples. So if you can use formulas that have these well-recognized natural anti-inflammatories, you will be improving multiple functions. So if you're thinking, well, that's a lot of stuff you just listed, how am I supposed to deal with all of that? I would say, let's put it as simple as this. You want to make sure you're getting some exercise every day. And not always doing the same thing, but balance it out. So if you're doing strength training, add some yoga. Alternate days for that. You want to make sure that your diet is cutting out all the processed crap. We're not going to go into more detail in diet than that right now, but cut out the processed crap. If you're looking for a good diet that kind of automatically cuts out the processed crap, I would probably say look up the paleo diet, because it by nature eliminates processed foods and processed crap. Toxins, if you're cutting out the processed crap, you've already dealt with most of people's toxins. The next thing would be if you have a job or that's, where you're exposed to a lot of toxins, try to reduce your exposure And if you can't, be using something to detoxify on a regular basis, but that's where the natural anti-inflammatories come in. Use a formula. We use something at the office called Revive Effects, where we've taken all of those listed natural anti-inflammatories, antioxidants, and things that improve immune function and immune balance, put it all into one powder. So you just take a scoop of that a day. So you could use a scoop of that a day. You could take a little bit of the Oral Effects and mouthwash at night, and done. Now, one of the things that you'll notice is that, well, what about deficiencies? How come you never listen to deficiencies in terms of part of inflammation? That is because those types of deficiencies are, at least for our North American audience, are not as common. And if they are common if they are a problem for someone, when you cut out the real processed refined foods, it's not like you're going to stop eating. So therefore, when you replace those, you're going to if you cut out the refined foods, you have no choice but to replace them with whole foods. And when you start replacing those with whole foods, you are automatically going to be correcting those deficiencies without having for me to list even more supplements. So in terms of trying to simplify everything, sometimes you can just focus on what you take away, because you have no choice but to put something else in. So I hope this information was helpful. I hope you can dive into some of your, look through some of the things that you're doing and things that you can start adjusting to reduce inflammation in your life. And this is Doc Yates signing off.
Thank you for tuning in to the Paramena Bliss podcast. Don't forget to hit the subscribe button and visit ParamenaBliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Paramena Bliss podcast.